everyone, welcome back to Instagram Live. I'm Dr. Amanda from IntimateRose.com, and today I'll be joined by Andrea Martin, the menopause specialist extraordinaire, and we will be discussing the symptom of breast tenderness as it relates to hormone changes. And Andrea. Hello.
Hi, good to see you.
Good to see you as well. So today the topic is breast tenderness as it relates to hormone therapy, but one of the things that is prominent during menstrual cycles from teenage years and beyond to perimenopause is also the symptom of breast tenderness. So I thought we could start with why breast tenderness occurs with hormone changes to begin with.
Sure. I'd love to talk about that. So usually the biggest culprit when we're talking about breast tenderness is estrogen. When estrogen goes higher, not lower, is when it causes breast tenderness. So we've talked about perimenopause before. That's that time leading up to menopause. It can be anywhere from like 4 to 10 years. And in the beginning of perimenopause, your estrogen levels are like, wee. It doesn't just go down. You've got these big spikes where your estrogen's actually higher than it normally would be. And you can get some pretty wicked breast tenderness during that time. There's actually this specific phenomenon called like loop events or luteal phase or luteal out of phase events. So normally, our menstrual cycle has 2 halves. And in the beginning, we have more estrogen, and then the second half, we have more progesterone. So when you're getting into perimenopause, sometimes your brain is sending signals to your ovaries like, hey, let's go. You haven't ovulated. What's going on? So they send extra signals. And then the little follicles on the ovary are like, let me try again. So you have your first spike in the beginning, but then you get this extra spike on the second half of the cycle where you normally never would, and then estrogen levels go up very high. So a lot of times people during that time have breast tenderness and irritability and maybe heavier bleeding. So that can happen in the beginning of perimenopause.
So then that person recognizes all the other symptoms, such as itching ears, fatigue, sleeplessness, sweatiness, hot flashes, malaise, irritability, joint pain, muscle weakness, and they go to their provider, and their wonderful provider listens and validates their experience and provides them with hormone therapy. And then they experience breast tenderness. What do we do?
Exactly. So once you're on hormone therapy, it can be the dose itself of estrogen that could be too high, or sometimes it's just the initial, like, we're just starting, we need to let it kind of ride out, give it a couple weeks and it'll go away. But if you've started it and it's been weeks and you're like, this is better, typically then we would just bring that dose down a little bit so that you're still getting relief from those symptoms, but you're not having all that breast tenderness. And there's certainly things you can do in the meantime while you're waiting it out to see if things can calm down a bit.
That sounds very promising. Is there certain forms of hormone therapy that are more associated with breast tenderness than others?
That's a good question. Not that I'm aware of. It's mostly the dose. There is one weird thing with progesterone that occasionally, when that is too high, that can cause specifically nipple tenderness, not whole breast tenderness, which is odd. I don't know the reasoning behind that, but yeah, it's more so based on the estrogen and the how much of it you're taking and how sensitive you tend to be towards estrogen. Um, with patients in that very, very beginning phase of perimenopause, I'm not often giving them estrogen there because it's already too high. I don't want to add more fuel to the fire. Once it progresses a little bit and they're really getting those lower lows and, the hot flashes are stepping in, then it's like, let's just add a little bit to make the lows not so low. So it's a bit of a balance.
and you taper it to meet the needs of the person in front of you, because as you mentioned, some people are a little bit more sensitive, and we've talked in the past about progesterone sensitivity as well. So just listening and making those alterations.
Yeah, absolutely. It's funny. I've had patients that are so sensitive to estrogen, like even the first 2 weeks where they start like vaginal estrogen cream, where they're like, "Whoa, something's going on. This I'm feeling really tender," but that will go away. So it's again very individualized. You know, who feels some of that tenderness and who's doing just fine and notices nothing.
That's amazing. And so today we have two special codes for listeners. I forgot to warn them at the beginning that they needed to listen, but if they made it this far, they deserve their code. So we have a code for Intimate Rose tools, lubricants, balms, and that code is for 10% off on our website, and it is ouch. OUCH, ouch, in honor of breast tenderness. And then you also have a very special code. This is the first time that we've done this, where we have a discount code for our telehealth program for hormone therapy. Do you want to tell people briefly about our telehealth program for hormone replacement therapy or menopause hormone therapy?
Yes, absolutely. We just wanted to create an opportunity for people hormones who want the hormones and can't get the hormones. So very frustrating. I've heard from a lot of you that, want go to your clinician's office and talk about this and get told like, nope, we're not doing it, not time yet, this, that, all kinds of reasons. So this is an opportunity for everyone in every state to get personalized care. Like you said, it's telemedicine, it's all online. And you input your personal history and, information about your periods and all those type of things. And then we can set you up with a clinician that is trained in this stuff. They'll recommend the best treatment options for you. And then we mail it to your house.
So easy. And we have a free screening available on intimaterose.com just to help you assess where you're at and get some data points behind what you've been feeling. We also have people available to answer questions and support. So we try to make it as easy as possible. And like you said, no waiting rooms, no waiting lines at the CVS.
You don't need to wear pants.
You don't have to wear pants. Why would you? Donald Duck style treatment. Wonderful. So, Andrea, you have a special code. What is your special code?
I think it's Andrea 100.
Yes, it is. Andrea got 100 on her code test.
ANDREA 100.
Andrea 100, and that's good for if you go to intimaterose.com and you go to telehealth and pull down to HRT or hormone therapy. You will see the free screening there, and the screening is free. It does ask for a credit card, and that is in the event that you are going to make a purchase of the prescribed medications, again, that are prescribed by providers. So the code can be entered there at checkout, and that will provide you with that $100 discount.
Absolutely. Who doesn't want to save $100?
Everybody. Girl, the tariffs, isn't that the main? Oh my goodness. Well, thank you so much, Andrea. Is there anything else that you would like people to know?
One or two other things I'd say about breast tenderness. I actually looked up this statistic today because I was just curious. It was 80% of women are wearing the wrong size bra. So, and I'm not actually shocked because if you've ever gone, like, I highly recommend going for like an actual fitting, like one of those ladies that does all the measurements and this and that. It's much more complicated than I realized. I did it once and they're like, if you're this band but this cup, it's actually this size, and it's more complicated than you would think. So, again, if you're in that transition period where you're like, oh, I just want this to get better, at the very least, make sure you're wearing the right size bra.
Absolutely. And additionally, those underwires can break down, they can bend and move in the washer machine. So all of that definitely counts for comfort level. And especially when we're wandering around with our cup pretty full of agitation as it is. And then we add some pokiness to it that can make for overflowing. And oftentimes that breast tenderness can get the focal attention in that moment. So that's important. And then the other thing, I don't know if you were going to mention this too, is properly fitting sports bras for those who are exercising, because that can also be a time of agitation. So, and likewise, lots of different fits, lots of different types of crissy crossy banding and under banding for different purposes. So if you're doing high impact activity, it's important to be wearing a high impact bra versus the cute little nothingness that's for yoga, or not that yoga is not hard, but it's not impact. So make sure that you are properly fitted, that the band has not broken down, because again, a year or two in, the elasticity can change and denature, and it's not supporting you the same way as well.
Absolutely. I know there are many of us who have a lot of old ass bras, and I because they're expensive.
They are. There's a comedian, Eliza Schlesinger, who does a full bit on bras. Have you seen this?
So
She talks about being fitted, and she talks about ugly bra, and it's the one that's most comfortable, and it's old, and you wear it when you don't want anyone to look at you or touch you. She calls it ugly bra. We do have a question. She's asking about anyone who
help.
who is an expert in pelvic health who can help with dilation. I think they're asking about a specific location. I'm not familiar with that location, but if you email our support team, we have pelvic physios all over the world that we can try to help put you in contact with. And we are getting ready to launch PT telehealth as well. So that's another offering for people who need access to PT telehealth.
I'm so excited for that.
Yes, me too. Just getting access to all the things.
We just want the access. The one other thing I will mention for breast tenderness that you may not have known that Intimate Rose already sells is that the chaste barrier Vitex can actually be helpful for breast tenderness.
Yes, absolutely. It can be helpful for people of all stages of life that are having menopause symptoms, perimenopausal symptoms, and also PMS. So those hormone fluctuations can be balanced, and it's a natural approach for those who want that one as well.
Yes, so we got lots of options.
That's right. Does anyone else have any more questions?
And then
Before
I was wondering what the code was going to be. I was like, I doubt it'll just be like breast.
Yes, when I was having the code made up, I went with the experience of pain, ouch, over the symptom itself. And then additionally, I have this awful necklace that I didn't realize was awful until it was too late. It's purple, so it's on brand, and it's giant balls. And I used to wear pretty like fun jewelry, and I wore it to clinic. And my colleague, like I walked in the clinic door, and my colleague was like, "Your necklace looks like a string of boobs." And I almost wore it today, but it was hurting my neck, and I realized this necklace is not doing me any good in any place of my life. So I opted out. So yes, we have ouch, and we have the absence of my boob necklace. Oh boy. All right. So ouch on the website, Andrea 100 for telehealth. And
There we
I
go.
think that's it. Thank you so much, Andrea, for sharing your time and expertise. We really appreciate you. And I hope everyone has a good rest of their
Yeah,
day.
thank you. Happy Thursday.
Happy Thursday.